Hi, my name is David Emerson. I'm a long-term multiple myeloma survivor and myeloma coach. Welcome. Today's vlog post is about a specific issue regarding autologous stem cell transplant. Essentially, autologous stem cell transplant has been determined to be safe and effective for elderly patients. I believe the qualification for elderly is 70 or older. Yes, if you want to undergo an autologous stem cell transplant and you're 65 or older, I think you need to have a sort of special approval from your oncologist, but more and more patients are doing it, are having an autologous stem cell transplant if they are 70 or older. The good news is that autologous stem cell transplantation essentially is safer than it was even 10, 15, 20 years ago. Autologous stem cell transplant, even for the younger patient, was taxing. And make no mistake, there are many, 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 even now, short, long-term, and late-stage side effects of autologous stem cell transplantation. To be clear, autologous, our own stem cells. Allo, someone else's, a donor stem cell. Much more problematic. Allo, separate issue. Multiple myeloma patients don't often get an allo. There are separate blog posts about that specific therapy. This vlog post is about people over 70 potentially having an autologous stem cell transplant. The main issue is, even if your doctor says, sure, I think you should have, you're healthy enough, you should have a stem cell transplant. Is it wise? Will it benefit you as the patient? And your caregiver is going to want to weigh in too. The issues that you need to wrap your brain around are progression-free survival, how long will your remission be, but more importantly, overall survival, length of life. Thirdly, and I think that oncology does a poor job of explaining this to patients, side effects, short, long-term, and late-stage side effects. There are a host of side effects, and email me if you want to understand these, and I'll send you numerous studies documenting the side effects, short, long-term, and late-stage side effects that result from autologous stem cell transplantation. If you, the patient, have less chemo on average, you'll have a lower risk of side effects. You'll feel better. You'll have a higher quality of life. These days, and your oncologist will back me up on this, I'm pretty sure if you ask him or her, you can live just as long with, they refer to it as novel therapies, Revlimid, Velcade. There are lots of chemo choices these days, daratumumab, which is also called Darzalex. There's lots to choose from. On average, the experience is induction, remission, you come out of remission, some more chemo, remission, more chemo, remission. All patients eventually develop immunity. But the question is, do you want to undergo lots and lots of toxicity during the lifetime of a myeloma patient? I believe that the more chemo patients undergo, the more side effects, the worse quality of life they experience. This blog post talks about studies that question the benefit to elderly patients. You, the patient, have to decide for yourself. If you want to email me, ask me a question, I'd be happy to answer them. All of my answers, usually 99% of the time, come with studies. I don't want to just say stuff. I want to say something based on research. So, to summarize, autologous stem cell transplantation is available to patients 70 and over. For the record, about half of newly diagnosed patients are 70 and older, so it's lots of patients out there. And there are lots of oncologists who are promoting autologous stem cell transplant. The blog post and the studies question the benefit of autologous stem cell transplant for an elderly patient, 70 or over. If you have any questions, email me, post a question or a comment, scroll down the page. I will reply to you ASAP. In the meantime, hang in there. Thank you for listening. Thank you for your time. Be well.